Hi, Dr. Brian Reagan, plastic surgeon at CosmetiCare. Welcome to our Instagram Live. And today we're talking about something that is really important to me, and that's drainless tummy tucks. Drainless tummy tucks. So the question is that we get a lot from patients is how do I do this? But really I want to step back and tell you why I do this. And of all of the things that we do, and at CosmetiCare, we do all types of aesthetic plastic surgery. We work on the face, we work on the body, we work on the breasts, we do fat grafting, we do Brazilian butt lifts, we do it all. We have many talented plastic surgeons here, but this is kind of a unique pursuit of mine. And the question is why, before I tell you how. Why is I'm constantly trying to evaluate my approaches and my techniques to do it better. And I either want to do the technique better or I want to do it in a way that leads to a better recovery. And that's where drainless tummy tucks come in. I have been practicing for over 20 years, and I have to tell you that I've only been doing this for about 10 years. That means before I did this, I did it the old-fashioned way. And it's not that there's anything wrong with the old-fashioned way, but I really felt like it could be done better, and I'm going to tell you why. So a mommy makeover is typically treating the changes that happen with mom from pregnancy. So it's usually something to the abdomen and it's something to the breast. That's a mommy makeover. And we do a lot of them here at CosmetiCare. One of the concerns that patients have with a mommy makeover is recovery. They think it's this really big operation. And I'm telling you, it is a significant operation. But historically, the recovery was brutal. It was 2 weeks of the patient bent over with tremendous pain.
Oh, swipe it back.
Oop, that wasn't us. And so it was a lot of pain. And that scared a lot of patients. Number two, scarring was often bad. And that scared a lot of patients. And so I just felt like it could be done better. And I also felt like the recovery could be better. And that's when I started looking into different techniques. And in fact, I trained at UT Southwestern, University of Texas Southwestern. And as I was finished my training in 2000, and I'm gonna put a plug in, it's probably the best training program in the country, or certainly one of the top three. There was a father and son team there in Dallas. And the father is the one that initially described this technique, drainless tummy tucks. And it took me 10 years to finally come around, but I came around, and it's the only way I do things now. So I felt like a drainless approach was easier for the patient, quicker recovery, less painful with better scars. So why wouldn't you do that? So what does it entail? So that's the why. The how on a drainless tummy tuck is we use these things called progressive tension sutures. Why do we use drains in the first place? Because we create this space and we feel like we need to drain this space or the fluid would build up. And that's sort of been the thinking in plastic surgery. Progressive tension sutures are internal sutures that tack the abdominal wall down. So why are we doing a tummy tuck? Two things. We tighten the muscles because those get stretched, or the rectus diastasis it's called during pregnancy, and then we get rid of the loose skin. Well, we still tighten those muscles like we did before. But now, instead of just pulling that skin down, making the cut, and sewing it together, we're now tacking that abdominal flap down. We're pulling it down and tacking it down. So there's absolutely no tension on that scar. In addition, the patients are able to stand straight up. And I encourage you, we're gonna show you some cases, I encourage you to go to our social media and you'll see it for yourself. So because we tack it down, you don't need drains. Because you tack it down, patients can stand straight up. They're not bent over. I almost always thin out. It's called Lipo Abdominoplasty. I thin out the flap so that you're nice and contoured. And I'll do liposuction of the back, of the flanks, of the bra line. I believe in looking at the patient 360 degrees. And I'll do the tummy tuck. There'll be no drains. If there's a Foley in, I usually put a Foley catheter in at the time of surgery. We take that out. And literally the patient's standing straight up after surgery, and you'll see pictures of them the next day, and all of these will be 1 day out, 1 day. So the progressive tension sutures allow me to tighten everything. I thin it out. It allows patients to stand straight up. Why is that important? Because after a tummy tuck, you want to be able to move. You want to be able to breathe. That makes it not only quicker for recovery, but safer for the patient. They're moving. They're not sitting around getting blood clots, okay? So it's better. It's better. It's better in every way. So I think the people who don't do it will say two things. Well, I put drains in and I get fluid out of those drains. So how are you able to not use drains and not get fluid? The second will be, while you're probably not taking as much skin out. And I'll answer the second one first. We are. I am tightening that down so that, and you can just look at post-op results and compare ours. My patients will have as much contouring with as much skin removed as any patient I've seen out there. Because I thin out the flap with liposuction, they're nice and thin. The progressive tension sutures allow me to tack and create what almost looks like a six-pack. You're gonna see some of that here. And of course we do the liposuction on the sides. So the fact is it's as good or not better. There's no tension on the scars. The flap's not pulling up on that scar, so the scars are better. And the recovery is less painful and quicker. And I'll show you some examples. So my patients are standing straight up and they're off narcotics often after a few days, 3 days, no narcotics. That's amazing. Now, the question is, if people who use drains see fluid, how come I don't get fluid? And the answer is because I think the fluid is coming from the tissues. When you don't tack them down, the tissues are rubbing across each other, and I think that's creating some of the fluid. So by tacking it down, the tissues are opposed and they stick, and we don't get much fluid, or if at all. So I just think it's a better way. I'm not the only one that does it this way. I know some colleagues that do it this way too, and if you are done the other way, it's not wrong, but I think this is a better option, and that's why I do it. I'm going to show you some examples, and these are also on our social media. These are all patients that are 1 day out. And for you patients that are watching this who had it done the other way, the old way, you'll be surprised. This patient is the next day. And these aren't little mini tummy tucks. You can see she's got a, there are a lot of things I do to get a great result. I try to make a very natural looking belly button. It's crazy. If you see a result that's awesome, but the belly button looks like a punched out hole, gives it away. I keep the scar low. I thin them out here. And this was her abdomen before. She's got a vertical scar. She's got a lot of laxity. This is her the next day. I don't show their faces, but they're smiling. The next day. Again, she had a vertical scar. She's got a lot of what we call lipodystrophy or fat. So I did liposuction in that area. That is her the next day. Notice the little crease in the middle, starting to kind of look like a little six-pack. Straight up, scars are low, symmetric, no dog ears, liposuction on the flanks. Okay, the next day. And I show her before there. Scars are low, symmetric, meaning not one end goes up. Each half is symmetric. Okay, by using progressive tension sutures, we're taking the tension off the scar. A lot of African American patients or patients with darker skin are afraid that their scars will look bad because the scar is long, and I tell them no. With this technique, I think scars are better, and you can barely see her scar here, but she, at this point now, she's about 4 weeks out. Scars are looking good. And this was a large abdominoplasty, and I thinned out with liposuction this area. This patient went to work the next day. Now I don't recommend that. I don't encourage that, but she felt good enough that she went, and she did a lot. She did. If you look at her abdomen there was quite a bit of laxity. We did liposuction, thinned her out. This is her the next day. She looked so good and she felt so good that she said she went in. Now, she also had fat put in her buttocks, a BBL, Brazilian butt lift. And she just said she stood at her desk, she just felt like it. She went to work for an hour or two, and she just felt good. But that's what's possible. Again, post-op day number 1, standing straight up. What does that mean? That means that by 1 week, they are pretty recovered. They're typically off narcotics by 3 days. You have to look this good at day 1 if you're going to be done at 1 week. What does that mean for the patient? Less pain, less narcotics, moving around, safer, back to their normal activities quicker, which is important. A lot of our patients are working moms. They can't take 2, 3, 4 weeks off. It's another 1 day right after, large abdomen, just looking great. 1 day. If you see my finger on our social media, if you see my finger like a number 1, that's because we're 1 day out and the patients are standing straight up. Okay? So that's my approach. Drainless tummy tucks. I do lipo abdominoplasty, so I do liposuction. I often do it on the flanks, the back, the bra line. We'll do a breast augmentation, breast lift, breast reduction. We'll do that all at the same time. We do give you pain medication post-operatively, and usually you take it for 2-3 days. Moving around is critical. It's better for everybody. And we've been super happy. I've been really happy with the results and the patient's experience and recovery. And for me, that's what it's about. That's what achieving another level as a surgeon, as an inquisitive surgeon is. I've been at it for 20 years. So at this point, what I'm trying to do is take all that time and all that training and the things I do, I try to do it at the highest level. And so it's been great. It's been a great journey. Thank you for joining us on Instagram Live. And if anybody has any questions, we're taking questions, and you will reach out to us on Instagram, right? I got my marketing ladies here. So, but hopefully I've answered most of the questions. And then a couple things. So how does the process work? Well, we do both Zoom and in-person consultations. If we do a Zoom, then I will see you at a pre-op. If you're out of town, you can come and we'll help set you up with accommodations. I typically like you to stick around for 10 days, but for sure 1 week. But the great thing is after 3 days, usually you can walk. If you stay nearby, you can walk around and enjoy. Not a lot, but you can walk around. We have our own surgical facilities here, fully certified, so it makes it really convenient, and we've got a great staff. So you're in great hands. We will take just wonderful care of you here at CosmetiCare.
Oh, someone asked if they had a tummy tuck 14 years ago, can you do it again?
So possibly. It depends on how much laxity you have, and there's no doubt I can make it better. I may have to. The belly button scar, when pulled down, may still be visible, and so I just have to evaluate the abdomen. But it's possible.
Someone wants to know how much for a tummy tuck starting.
So if we just did the tummy tuck, and usually that includes some liposuction, ballpark, don't hold me to it, but ballpark is around $12,500. And then if you add some more liposuction or you do breast work, then we add that on.
Okay, and someone said, what is the downtime do you need to be near your goal weight?
So if someone is within 5 to 10 pounds of the goal weight, then I'm fine with that. If someone's losing a lot of weight, then I want them at that goal weight for a couple of months. And this is the reason. When you drop weight, you're not necessarily in a good balance of nutrition. You might be starving yourself, you might be negative caloric. So I want the body and the mind in a good steady state, and we'll evaluate that. Often we do work on gastric bypass patients, weight loss patients, and usually we like them at their steady state for a year.
And someone asked, do you go by BMI?
For the massive weight loss patients, often if their BMI is a certain level, then we'll refer them for weight loss surgery. We do evaluate the BMI, but I've done work on patients that might benefit from gastric bypass, but they're just not going to do it. And so we will evaluate those patients.
Okay, let's see. Teresa said she loves you.
Teresa Eubanks. Oops, I'm not supposed to say names. Sorry.
Oh.
Hi, Teresa.
Perfect. I think that's good. Nobody else has any questions.
Yeah. I'm just super thrilled with, and I'm, at this point in my career, I'm just trying to do things the way I think are the best, and I'm really happy that I pushed forward and had the confidence with the support of the team here to do that and to offer it. And not every doctor does it this way here, and maybe they're just not quite on the same place that I am on the journey. And so it's not that they're not going to get good results, but I just think my patients are recovering a little bit easier, a little bit quicker. That makes me happy, makes them happy.
Okay, a couple more. Tummy tuck or lipo?
So my philosophy in offering cosmetic surgery is I try to get where I think the patient wants to go with the least invasive technique. If I think I can get the result they're looking for with lipo alone, I'll do it. But unfortunately, if there's too much laxity, or there's been children and there's the rectus diastasis, which is the weakening of the abdominal wall, lipo alone is just not going to do it. And the great thing about this practice is we have other tools. We have Body Tight, which for some patients we can do lipo and then the Body Tight and we can get a nice result. But remember, with the tummy tuck, we're tightening the muscles. And don't fear the scar for a tummy tuck. Don't fear it, because the scars look great. They are hidden under a bikini, and I have never heard a patient tell me afterwards, boy, I wish I didn't do this because the scar's so big. I've never heard that. Their results are so great, and they can wear a bikini that they don't care about the scar.
Someone asked, will a tummy tuck take away stretch marks?
Yep. If the stretch marks are all below the belly button, then they will be gone.
Okay. And then someone said, do you recommend wearing a binder or anything post?
Yeah, our patients wear a binder for about 2 weeks.
And does it
or
help with
they
the
get into
results?
Spanx.
Oh, okay. And it helps with the results?
Yes.
Okay.
Because remember, we're doing liposuction too. So compression helps.
Okay. Someone asked you to tell your story on how or why you started this method. I think you already did earlier, but
because patients, the recovery was long. The perception was that it was a painful, long recovery, and the thinking behind the Drainless approach using progressive tension sutures would, one, make the recovery seem easier. It is easier. It's less painful, better scars. So there were so many positives. The only potential negative was, well, what if they get fluid? So when I first started doing this, I had a very low threshold for checking for fluid, and I would put a needle in. It's numb, so the patient doesn't feel it, but I put a needle in to check for fluid, and I wouldn't get it. And I finally realized, no, we're not getting any fluid.
All right. Any other questions?
Any other questions? And so often we're doing this in conjunction with some liposuction out of the flanks, the bra line. We're doing breast lifts, breast reductions, implants and lifts, and it's one of my favorite things to do because patients are so happy and thrilled, and I think moms out there do a wonderful job bringing kids into this world, and sometimes it just affects their bodies in a way that they can't control. And I just like seeing mom do something for herself and getting that confidence back with her body, and we can help with that. So it's very rewarding.
Let's see, I have a couple more. How soon can you work out after a tummy tuck?
So you can start working out, so you can start being active, maybe stationary bike at 2 weeks, back in the gym at 4 weeks, no restrictions at 6 weeks. That's assuming everything heals well.
Okay, and someone asked, how long does the surgery take?
So the total surgery time is surgeon time plus when you go to sleep and then when you wake up from anesthesia. So if we just did the tummy tuck, you're looking at about 4 total hours.
Okay. Perfect. I think we're good. You want to tell everyone, see you later? So
this was great, and we're going to do more of these. And thank you for those patients that responded. And if you have any other questions, just give us a call. We'll get you in here for a consultation.
Oh wait, we have one more. Does a tummy tuck take away all fat cells? If so,
No.
You can't gain weight back in your tummy?
No, you never remove, even with liposuction, you're never removing all of the fat cells. But the question becomes, if you thin everything else here and then you gain weight, will you gain it somewhere else? And you might. You might gain some of it back here, and you might gain some of it somewhere else.
Okay.
All right.
All right.
Wonderful. All right, everybody. Thank you.